Okay, well, as the number of COVID-19 cases grows, 2 convention centers are still being converted into field hospitals. TCF Center downtown and the Suburban Collection Showplace in Novi. Jim Kurtzner has more on how shortages of materials and staffing will affect these new operations.
The TCF Center is close to being open and accepting patients within days, but orders for masks and gloves won't be here on time.
For our staff, not the healthcare community, but for our staff at TCF Center, we're being told that they won't arrive until April the 20th.
The Army Corps of Engineers is leading the way on the transformation of TCF for 1,000 hospital beds, 600 on the main level, 400 on the lower level. The in-house construction workforce and union trades are assisting, installing the infrastructure, and food service staff will be working after it opens. It's a big operation.
So we've got about 130 people that we've got to be sure that we can protect when the patients start coming in.
It was just announced yesterday by the governor that the second field hospital will be here at the Suburban Collection Showplace in Novi. The same build-out is underway there for another 1,000 beds. This could be days away from being open and ready.
We feel in these unprecedented circumstances, it's extremely important for us to serve as a resource to the state and the community to help in these times of need.
Detroit hospitals are taking a beating, their own staff becoming sick with the virus by the hundreds. Where will medical staff come from to work in the field hospitals? The governor says the call is out, and as a last resort, she could order medical personnel to come to Metro Detroit from up north.
The question of, ordering, I hope that we don't have to get to that point. Sorry, that's my dog, Kevin. But it is something that we recognize is crucial that we've got those facilities staffed up.
Mayor says the plan for now is lower risk patients with COVID-19, and those coming out of intensive care will go to the field hospitals, and the numbers of patients will be phased in.
They're not going to open with 1,000 beds overnight. Nobody could do that. But could they open with 100 beds in a week and start to take some pressure off and then ramp up as they go? I think they can.
Governor says the feds have some medics who can fill in here. She's also working around the clock to make sure they have what they need. In downtown, Jim Kurtzner, 7 Action News.
Thank you much.